Welcome to Common Sense Care, parenting gender confused kids with truth and love, brought to you by Partners for Ethical Care. So called affirmative care is the gender industry's one size fits all answer for any and all children who struggle with their identity. In no other area of medicine, psychology, or education is one treatment plan assigned to every person. At Partners for Ethical Care, we believe that each child should be treated as an individual and given the care and support that's appropriate for him or her. This morning, we are talking about parent support, getting help, and avoiding harm. And I'm Maria Keffler.
And I'm Erin Brewer. And this is such an important topic because oftentimes when parents are confronted with some kind of crisis, it's so easy for them to put all their energy into the crisis and not take care of themselves.
Yeah, well, this morning, as I was getting ready for our talk, I was thinking, no, wait a minute, why did we decide to do parent support and getting help for the parent before like child support and getting help for the child? Because as a parent, that's our first instinct, right? Is to take care of our kids. So help me remember, why did we decide to do it this way?
Well, and it's funny, this is a really important principle of care. And I was actually an EMT when I was in college. And when I was
I didn't
training
know
to be
that.
an EMT, yeah, when I was in training, the first thing that they emphasized is that you can't help someone else if you're not in a position where you're safe. And so if somebody's drowning, you do not jump in to save them because more often than not, that person will actually drown you too. Or if there's somebody who's in the street who's been shot, you have to make sure that you're safe before you run out to help them. Otherwise, you could get shot too. And I think that that principle applies here. That if a parent is in a place where they're not functioning well, they're not able to take care of their child. And so it's really important for parents to find ways to really do good self care so that they do have the energy and resources to focus on their children.
Oh, that's such a good point. And I think a lot of times we tend to think of self-care, at least women tend to think of self-care as, getting a mani-pedi and going off for a weekend. But that's not really what we're talking about here, are we?
No, I mean, I think that that is actually a reasonable thing to do for self-care.
Mhm.
Do things that you enjoy. I think that that's very valid. Things that will relax you, things that give you some time to yourself. But another really important component of self-care is self-thought and really monitoring how you're thinking about things, whether you're getting enough sleep, whether you're eating well, whether you're maintaining your social connections, and it's ironic because one of the therapeutic techniques that is used to help children overcome their gender identity issues is called cognitive behavioral therapy, and it involves basically changing the way you talk to yourself. So rather than, in the child's case, rather than saying I'm born in the wrong body, saying I'm born in the right body, I'm just born, I don't fit stereotypical roles or something like
Yeah.
that. For a parent who's in crisis, it might be, boy, the situation sucks, but it's not the end of the world and I can get through this. So, really monitoring the kinds of things that you're telling yourself because we know that the messages that we tell ourselves actually have a big impact on how we feel. And if we're telling ourselves this is the end of the world and we're in huge crisis, it's going to be hard to sleep. It's going to be hard to maintain good nutrition and it's going to be hard to maintain personal contacts.
Oh, that's a really good point. I went through therapy some years ago for postpartum depression after one of my kids. My hormones got all messed up. I was struggling with some relational things at the time and ended up in psychiatric care for about a year for postpartum depression. And one of the things that I learned through that was listening to what I'm telling myself when something's happening in the home and it's a crisis. Oh, this is terrible. Oh, this is a disaster. Oh, this is gonna, that's not helpful to me to resolve what's going on. But like you said, just to say, okay, the glass of grape juice just spilled all over the refrigerator. It's a mess, but it's not a disaster. I just need to clean it up. I just need to start this. And then when I was healed and ready to move out of care, I remember my psychiatrist, the last thing he said was, you need to eat well, you need to sleep well, you need to have supportive relationships, and you need to exercise.
Uh,
And holding on to those four things have really helped in so many different areas of life.
And one of the things you mentioned, those supportive relationships can be really difficult when you're in this issue because some people will not be supportive. In fact, a lot of people, and potentially most people, and maybe even all people that you know, may not be supportive of your stance on this. They may feel like you should support your child and their gender identity, and so that can be one of the areas where you might have to actually go out and build new relationships, get some support from outside your normal circles, because you may not be able to find it with the people who you would normally rely on.
Yeah, it's so important, especially with this issue, to start to identify which relationships for both you and your child are helpful versus harmful. And parsing those out will help you recognize, okay, this is not somebody who's going to be helping to me here, but this person is. And also defining what is meant by support, because that word support
Mm.
is used a lot by the gender industry. And a parent who does not say, yay, I'm so glad you want to change your gender, your sex, I'm so glad that I thought I had a daughter for 13 years, but I'm just going to embrace that now I have a son. That's what the gender industry calls support. And parents who don't do that are called unsupportive, but that's not really what real support is. Real support. Well, I want to hear how would you define real support in this situation?
Well, in this situation, I think it's people who will validate your feelings, and listen and not tell you how you should do it. And in this particular case, I think finding other parents who are in the same situation can be really valuable, so that you know you're not in this alone, because this can feel so you can feel so alienated from your friends, from your family, your child, your the school, potentially even your spouse. I mean, it can really cause a sense of alienation. And if you can find other parents who are going through this or who have gone through this, that's going to help you to realize you're not alone, and the feelings you're having are reasonable, and that your approach is really what's in the best interest of your child.
Yeah, yeah. And for yourself, support is going to have a lot to do with people reinforcing that no, you're doing the right thing. I know this is hard, but you're doing what you think is necessary for protecting your child. This is a little bit of a tangential topic, but I found this so valuable. Have you heard of ring theory when it comes to support? I saw this a while back and I thought it was so powerful, and I looked it up. And it's Susan Silk and Barry Goldman, and they did this little diagram called ring theory. And so you've got a ring in the center, and this is the person who's most affected by whatever crisis it is. So let's use the example of somebody has died. Say your parent or your spouse has died. You're the person at the center who's most affected by that death. And then just outside of that are people who are less affected than you, but still affected. So maybe extended family, close friends. The next circle outside of that would be, acquaintances, maybe some of the doctors, nurses, people who are not as emotionally affected, but who are aware of it. And then outside of that, of course, as you go out, then it's the people who are less and less affected by the crisis. And what Silk and Goldman said was, you give care toward the inside, and you dump your feelings to the outside.
Mhm.
So I think we've all had the experience of we're in crisis about something, and then somebody who's a little bit removed from the crisis comes to us and just says, I just can't deal with this crisis you're having. This is awful. I need support. And you're like, I'm not the right person to give you that support.
Right.
um, you can dump those feelings to people who are further removed from the crisis, but the person who's on the inside of it doesn't need to be supporting other people right now. They need to be receiving lots of support.
And it's okay to say that if people come to you and you're the one who's in the middle of the circle who needs the support, and people come to you trying to pour out their feelings on you, it's okay to say, you know what? I need you to go find other people to get support from, because right now I'm the one who needs the support. And that's, we're not trained to do that, but it's okay to do that.
Yeah, yeah, it is. And as parents, again, as we said earlier, we're so focused on taking care of our children that we don't recognize that sometimes we do just need to say, I need care, I need help, I can't do this right now, and reach out.
And it may be that you need significant support. You might need help from medical professionals. You know, if you're at a point in a crisis, I know that there was a time in my life where I had a crisis and I really could not sleep and eat, and I just sort of spiraled to the point where I was really not healthy because I wasn't eating, I wasn't sleeping, I wasn't in a good place, and I actually got some help. Like you said, got some therapeutic help to kind of stop catastrophizing, to get some insights onto what I needed to focus on to get a handle on the crisis. But also, I got some medication to help me sleep for a couple weeks, because if you don't sleep, you can't think straight. And a lot of times when people are in an emotional crisis, the first thing that happens is they can't sleep. And then they get into this cycle where they can't sleep, and then they can't do other kinds of self-care, they can't reach out for support, and then they can't sleep, and it just can get into you can get into a really unhealthy place really quickly, because you go a night or two without sleep, and your thought processes get really mixed up.
Yeah, I have never really struggled with anxiety. I'm really pleased and lucky that way. But I did have a crisis one time where I couldn't sleep. And I was so stressed and so anxious about what was going on. And what would happen is I'd be exhausted and I'd drift off to sleep. And as soon as I got to sleep, I would spring awake. And it was like my brain saying, "Don't sleep. We're under attack. You've got to get up. You've got to do something." And I talked with a friend of mine who's a social worker, and she said, "Yeah, what's happening is your brain is in fight and flight mode. Your brain feels like you are actually under attack. You're a gazelle out on the savannah, and there are lions around, and your brain is saying, now is not the time to sleep. Now's the time to run." And like you said, you do that for a couple of nights, and then your brain isn't working right. Your brain is feeling like it's under attack all the time, and you don't sleep, so you don't think well. So then you're stressed more, and then you don't sleep. And this friend of mine said sometimes a patient just needs that medication to help them sleep, to reset the cycle. It's not that you need sleep medication for the rest of your life, but you need it to break out of that cycle that you're in.
Yeah. And the other thing that I do, and I don't know if other people do this, but I start to breathe more shallowly. So instead of taking deep, cleansing breaths that are centering and grounding, the more anxious I am, the more I do these like little breaths that can actually really can keep you in a state of anxiety. And so just taking a moment and maybe watching a meditation video on YouTube and really breathing will help you center, and that alone can do wonders if you're in the middle of a crisis and you just need to get a handle on it.
Yeah, that's a really good point, because one of the things that we do when we panic is that shallow breathing.
Mhm.
Again, our bodies are getting ready to run, they're getting ready to fight. But another thing is sometimes we take a breath. If we're really shocked or upset by something, we'll just freeze up and stop breathing,
Right.
and forcing yourself, okay, I'm going to take a deep breath, like really deep, in and out several times. It's amazing to me how differently you feel after just doing that, because what you've done when you take a deep breath, you have flooded your brain with oxygen, and
Mhm.
your brain needs oxygen to process things. You've flooded your muscles with oxygen, and that is life-giving. Oxygen is life. We can't survive without it, and that helps tremendously.
And that's, I think, where the exercise comes in, is that it keeps you healthy, but it also forces you into a good breathing pattern. And so all of these things, and eating well, we didn't touch on that, but some of us have a habit of going to our comfort food when we're anxious. And if your comfort food is candy, chocolate, And coffee. There have been days where I've just eaten nothing but chocolate and had coffee. And if you do that for a day, it's okay. If you start doing that for days on end, you're really gonna cause problems with your body. It's hard
Yeah.
for your body to be healthy when you're just eating a bunch of junk food. And
Yeah.
the other end is people who might go for that really macaroni and cheese, mashed potatoes and gravy, that really heavy food. And that's probably a little bit better than just chocolate. But again, it can kind of weigh you down. And anytime your body's not healthy, it's going to impact your thought processes.
Yeah. When I was younger, when I got stressed, I wouldn't eat.
Hmm.
I kind of miss that, I'll be honest. It really helped with the weight.
Yeah.
But now I've gone the other way to where I eat the comfort foods. But that is something to watch too, because there are people who, when you get stressed, when you get sad, when you get anxious, you just stop eating. And that's not healthy, of course, either, because your body needs fuel. So just making yourself do the things that you know are healthy, making yourself make those healthy choices. It's hard in the beginning because that's not what you want to do. You want to wallow, you want to eat the chocolate, drink the coffee, lie on the couch and cry. Sometimes you can do those things for a day or two, but yeah, if you do them long term, they're really going to prevent you from being able to deal with things effectively.
Well, and especially if you have other children at home, you really have to keep yourself healthy and your defenses up, because you not only are going to have to parent the child who's got the gender identity issues, but you're going to have to deal with the repercussions of that within your family and how your other children handle that, or how relatives handle that. Or you might have to go have really intense confrontations with school people. And so the stronger you can be, the more you're going to be able to take care of your child and advocate for them. And you mentioned at the beginning about getting a mani-pedi, and I've never had a mani-pedi, so I'm not sure exactly what that is, but or going out and getting a massage. And I would recommend that people make a list of things that help them to feel good, because when you're in a crisis, sometimes you forget that there's things that you really enjoy doing, like maybe making a cup of cocoa and going and sitting and watching the birds is something that really helps you to feel better. Maybe going and getting a facial, maybe going on a long run, or going for a swim. There are all kinds of things that people enjoy, but we can often forget what those are. We're in the middle of crisis. So it's not a bad idea just to have a list of those next to you so that you can do those self-care things and make sure that you take care of your needs.
Yeah. My mother-in-law and father-in-law went to it was a marriage retreat sort of thing, and she came back from that and talked about one of the things they emphasized was doing things that give you life. And
Mm.
I loved that phrase, doing things that give you life, because for some people working out gives them life. I have a friend who, she got through a really nasty divorce by working out. She just loved it, and that was the thing that
Some of
really
us,
made her good.
oh no.
No, that's not. No, and so when people shame like young moms for not staying in shape and go like, I work out 6 times a day, why can't you? Well, working out gives you life. That's not what gives me life. And
Mhm.
when I had young children, maybe one thing, I could fit in one thing that I liked. And for me, when my kids were small, that was knitting and crocheting. That calmed me, that gave me peace. Other people would find doing crafts tedious and life destroying. But yeah, finding what is it? Is it going for a run? Is it taking a walk? Is it, scrapbooking? Is it playing the violin?
Yeah,
Just
watching
making
a
sure.
silly movie.
Yeah,
And
laughter is great medicine.
yeah, and
So
yeah, if you can keep a sense of humor about this, even though these are very serious issues, if you can keep a sense of humor, that will help as well. And we have a video from someone who I think does a great job of explaining one simple technique that can really help ground people when they're in the middle of a crisis, when they're, right there in the middle. If you can remember to do this, it can change your whole outlook.
Studies tell us that even a 2-minute distraction is sufficient to break the urge to ruminate in that moment. And so each time I had a worrying, upsetting, negative thought, I forced myself to concentrate on something else until the urge passed. And within 1 week, my whole outlook changed and became more positive and more hopeful.
Oh, that was Guy Winch. And I wanted to emphasize one of the things that he says in this video. I love this. He said, when you are in pain, treat yourself with the same compassion you would expect from a truly good friend.
Oh, isn't that so true? We so often are hard on ourselves in a way that we would never dream of being on someone that we loved and cared about.
He gives the example in that video of someone who goes on a date, this first date she's had after a 20-year marriage has dissolved. And halfway through the date, the guy gets up and says, I'm just not interested in you, and walks out. And this woman started like self-denigrating, like, of course he's not interested in me, I'm old and I'm ugly. We would never do that to a friend. If a friend called me and told me that happened, the first thing I would say is, well, that's his loss. He doesn't know what he's got there. I would encourage her. And we need to do that for ourselves, don't we?
And it's hard because we're really not brought up that way. We're brought up to be very self-critical, but it's not healthy. And so I would encourage people to just practice those very affirming statements to yourself, that you're lovable, that you can get through this, that you're strong, that you can handle this. Those kind of self-talk messages, even if it sounds kind of odd, really say them to yourself. Remind yourself to say them when you're in the middle of a crisis. And then also that just stopping and, what he talked about, how that 2-minute break can really change the trajectory of your day.
Mhm. Yeah, I love that. Intentionally redirecting your thoughts. We do that with kids, right? When kids are in crisis or they're misbehaving or they're doing something that they shouldn't be doing, one of the most powerful tools we have is just redirecting them. Let's look over here instead. And yeah, changing your internal monologue.
Yeah.
And I think that you can also apply the validation and invalidation technique. Well, invalidation is not a technique we want to use, but the validation technique to this, where we want to validate our own feelings as well. Yes, I feel sad, and it's not wrong that I feel sad. I feel hurt, and it's okay that I feel hurt. And we can problem solve separately. We can look back and say, all right, was what I did there effective or not? And analyze what we did and try to decide, oh, maybe I need to take a different approach with this. But for our feelings, we want to validate and honor those and trust ourselves that, yeah, I'm doing the best I can with my feelings.
Yeah. And don't beat yourself up. Yeah, I think that's really important. So we have a question from a viewer. It says, I feel guilty focusing on myself when my son is in crisis. I could spend all of my time dealing with his needs and those of the rest of my family. How do I figure out what's appropriate amount of self-focus for my own care? And boy, is that a good question, because the fact is we have to take care of ourselves, but we're still parents. When we're in crisis, those responsibilities don't go away. And in fact, they amp up when we have a child who's in crisis. And so that's a really good question. How do you balance that self-care versus caring for others? And I think, I reflect back again on my EMT training, that if somebody's drowning and you jump in to save them, you might drown too. So you have to make sure you're stable, that you're firm, that you have a good lifeline, and then reach out to someone to help them. And in the case of parenting, what that means is make sure that you have support system, make sure that you're taking good care of yourself, and then try to figure out how you can help your child. But also, one of the things that we do as parents is that we take on the full responsibility of our children, for their happiness, their well-being, their success. And especially with older adolescent kids, they have autonomy. And on some level, they are responsible for their behaviors. So our job is to act as a support for them, but we can't save them. In this case, the analogy of the drowning person doesn't work. We can't just throw in a life vest and pull them out. This might take weeks, months, years of efforts. And so that's why getting yourself in a good emotional state is important, because you're in it for the long haul. And so I would say that when you start feeling that you're out of sync, that you're not sleeping well, you're not eating well, that your thoughts are racing, that's when you need to pull back and really focus on self-care.
You know, just this morning, I saw a post in a help group. A parent said, I'm just beating my head against the wall with my daughter on this transgender issue, and I'm validating her feelings, and I'm, you know, discussing the ways this is illogical, and as far as I can tell, I'm doing everything right, and it's just not making a dent, and I'm so tired and I'm so exhausted. I just want to give up.
Wow.
And the parents who jumped in support of her was just, that was what we need. They said, no, you're doing a good job, mom. You're doing the best you can. This is a really pernicious brainwashing that your child has been through, and it's going to take time. And somebody else said, she's hearing you. You may not see any evidence of it, but she's hearing you. And there was just comment after comment after comment supporting her and encouraging her. And I thought, this is what we need. This is what we need in every area of our lives,
Yeah.
is friends who are going to tell us, no, you're doing a great job. I'm really proud of you. And going back to my bout with postpartum depression, I had a good friend, a really dear friend, come to me before I realized what was going on. And she said, Maria, something's wrong. You are just not yourself. You are just not acting like yourself. And that made me stop and step back and go, you know what? I don't feel the same as I did 6 months ago. And having that person come to me and say that to me in a loving, caring way, I mean, that was just the best thing she could have done for me at the time. We need those kinds of friends.
Well, and I think that that's that you've kind of hit on something that's important, and there's a line between sort of crisis and angst and trying to grapple through these issues, and all of those feelings that go along with it and emotions. And at some point, sometimes you can cross the line into something that's clinical, become clinically depressed, develop an anxiety disorder or a panic disorder. And when those happen, the self-care may not be enough. And you might have to get either pastoral care or help from a therapist or a counselor or a social worker, because and that's, it's hard to know where that line is. But in your case, you had someone say, something's really off here. And so if you feel like you've gone past a place where you can bring yourself back, that's a time to reach out for help.
Well, one of the ways that I recognized that I was beyond the point of just needing self-care was I would go for self-care. Like my husband would take care of the kids, and I'd go off by myself for a couple of hours, just go sit at a coffee shop and relax. And when I came home and walked in the door, it all came back on me again. It was like I had had no self-care at all. And that was a clue to me, like something is wrong here, that I'm not even reaping the benefits of 2 hours of self-care. So that can be a clue.
Yeah, and you also mentioned the importance of that support system. And for people watching, if you don't have a support system, I'm going to list some resources in the description below, because there are groups that you can go to that will help link you in to support systems. And sometimes, especially if your extended family supports your child's gender identity, the school supports your gender identity, perhaps your close friends might do that. It's really important to find people who will support your perspective and your parenting this child, knowing that what you're doing is saving them from a lifelong medicalization, and you need support with that. And so we'll definitely list some resources down below.
We have one more question. This relates also to sort of finding those things that give you life. This parent said, I went from school to working full time to having kids. I've never really had any hobbies or downtime. How do I even figure out what would feed and restore me?
Oh gosh, I think that maybe some of us can relate to that. It's like, what? I mean, it has taken me a long time to figure out what is restorative to me, because I did that. Bang, 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 graduated from college, had kids right away, and never really got a chance to get to develop hobbies or self-interest or really good self-care techniques. And so I totally relate to that. And I think it's just a matter of time. Maybe try lots of different things. Do you like movies? Go to movies. They have some of these studios now where you can go and paint. And maybe that's what it is. Maybe you just need to go get yourself some oil paints or watercolors. Gardening. There's all different things. So maybe even Googling hobbies on online and just see what comes up and see if there's anything that really seems like it might resonate with you, and give it a try. I mean, that's the beautiful thing, is that you're not locked in, so you can try these things and see, is this, and at the very least, it will give you an opportunity and experience and distract you for a little while from what's going on in your life. And you might find something that is really healing.
Yeah. Another thing you might try is, if you have friends who have certain hobbies, ask if you can go with them to do it. If you've got a friend who plays tennis every week, can I just come and play tennis with you? Or if you've got a friend who knits, could you teach me to knit? Those are great ways that are a little bit lower stress, because you sort of got someone to lean on as you're trying it out.
Yeah, and that's a great idea too, because then you have someone to talk to as well.
Mm-hmm.
So there's lots out there. Again, I don't want to minimize in any way how difficult it can be. We can talk about these ideas for self-care, and I know from personal experience, it's not always that easy. Sometimes you really have to force yourself to change your thought process, force yourself to take care of yourself. But you can, and you will get through this. And you're doing such important work taking care of yourself so that you can take care of your child.
And before we go, we had one more viewer who sent in a really great summary, sort of what people do when problems and issues come into their lives. And she said, in trying to solve a problem, we often do one of four things. One, we try to change and control the circumstance, the other people and the things that happen around us. You touched on that, trying to control kids that we may not be able to control. Or two, we try to change our actions, our behaviors and words in order to control other people and events. Or three, we avoid escape by engaging in distracting false pleasures, the busyness, overeating, over drinking, over exercising, over crafting, Netflixing, Facebooking, whatever. Or we indulge in self-pity, self-loathing, worry, confusion, indecision, and overwhelm. These are often harmful, they don't work, or they're unsustainable, or ultimately have a negative net effect. It's when we can face our fears, anxiety, self-doubt, self-loathing, and learn to allow and process all of these things, that we then experience less of them, and we become the next best version of ourselves, knowing we can handle hard things.
Yeah. Oh, isn't that wonderful? So I love the positive spin on this, that whenever there's a crisis in our lives, at the time it's really difficult, but we grow from that.
Well, thanks, Erin. I think this has been such a necessary topic, and I appreciate your insights, especially from your EMT training. That was really powerful, and I learned something about you that I didn't know.
Well, thank you, Maria. And what do we have on store for next week?
Oh, next week we are going to talk about finding care for your child, finding trustworthy support for your child through this.
Boy, and that's going to be an important issue. And again, another reason we wanted to do this episode first is that in order for you to be a good advocate for your child, you need to be in a good centered.
We are not doctors or therapists. We are not giving medical or psychiatric advice, and we offer no guarantee of outcomes. We simply want to talk about how to support and love kids using long understood best practices from the fields of psychology, education, and child development. We're glad you joined in our conversation today, and we hope that you took away something you can put in your toolkit for parenting your gender-confused kids with truth and love.